Good evening. Namaste. Happy Dasara or Vijayadashami to all. And, let the victory, let the good triumph over the evil. So, let us start today's session with this saying. So, I am Dr. Aparna. I am an emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. So, in my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions on Ayurveda, mental health, psychotherapy, and related subjects. So, one of the ways to attain, I regularly talk about emotional wisdom, emotional metamorphosis, emotional intelligence. See, one of the ways is reading books or listening to, audio podcasts of the book, whatever is, interesting to you, because all are available. So, in today's session, there is a beautiful book on on psychotherapy, and maybe the title itself suggests the summary of it, like maybe you should talk to someone. So maybe you should talk to someone is a book authored by a psychotherapist herself, Dr. Lori Gottlieb. So she has written this book beautifully. We are gonna see why this book is important to read. And this book is for people who think that psychotherapy is for own is like a stigma or a taboo, or for people who are mentally ill. So talking to a therapist may not be only for people mentally ill. This book, when I read this book, for every psychotherapist as well, reading this book at least once is quintessential. Okay, I'll let's not waste time and let's get into the book. Like, see, this book, maybe you should talk to someone. This is a non-fiction book. As I said, it is written by Lori Gottlieb. So she is a psychotherapist, and um, she's a New York Times best-selling author. So what is this book about? See, this book is a blend of a self-help and insights into the life of a psychotherapist. So, providing readers with an insightful and often humorous look into the world of therapy. So, this has a unique perspective from both sides. Like she also, Gottlieb also shares her experience as a therapist, and she is in this book. She shares her experience as a patient herself. So yes, this book talks that a psychotherapist also is a human. A therapist may also need a therapist. A therapist needing a therapist. So from us, she from being a psychotherapist and a national advised columnist, she comes with a thought-provoking book. See, what this book does is, behind the scenes, people do not know what actually happens, in the therapist's world, and what happens when people are looking for answers from a psychotherapist. So, one day, what happens is, Lori Gottlieb this book is all centered about, her story, the author's story, and four of her patients, stories. So it revolves around this. So it starts by, she is a therapist herself who helps patients in her practice. But the next moment, a crisis causes her world to come, crashing down. And then she finding a psychotherapist, and a seasoned psychotherapist, and and exploring, and also, exploring life as a patient herself, and then also explores the inner chambers of her patients lives. So what happens in her patients, like there are four patients. Like one patient is a self-absorbed Hollywood producer, a newly diagnosed terminal illness patient, a senior citizen, who is threatening to end her life on her birthday if her life doesn't get better, and a story of a 20, of a girl who is in her 20s, who can't, who's succumbed to taking wrong decisions in life. So with startling wisdom and humor here, the author invites us into her world as both clinician and a patient, examining the truths and fictions we tell ourselves and others as we, teeter on the tightrope between the love and desire. See, this book is, highly recommended because of several interesting reasons. First is insight into therapy. So, this book provides a unique and candid view of what happens inside a therapy room, what actually happens inside a therapy room. So, the mystery is demystified. The mystery of, or the process, people who want to know what happens in the therapy. So, it demystifies the process, making it more approachable for those considering therapy. So this book also, describes, what is the difference between, counseling and therapy. These terms are usually interchangeably used. So so what is counseling here and what is therapy? Many of you have asked me the question as well. Many of my clients also ask me this question. So what is counseling and what is therapy? What is the difference? See, counseling, the focus of counseling is that it typically addresses specific issues or challenges. It is often more a short term solution focused, in a more short term and a solution focused manner. This is counseling. It addresses specific issue. Like what? See, counseling may be used to provide guidance. You counsel someone, the word meaning support and practical advice for issues. Like if there is some, might have heard a word relationship counselor. So for relationship problems, a career counselor for the career transition or the career, counseling aspect, and coping with life challenges. These are, they are called counselors. Marriage counselors, relationship counselors, career counselors. So they address a specific and a short term issue, specific issue or a challenge, which is more solution focused manner. Then see, and here therapy on the other hand tends to be, it is more comprehensive. So it delves into deeper emotional and psychological issues. So therapy often involves exploring past experiences, patterns of behavior, and their impact on presents, your thought processes, past experiences, the patterns of behavior, how is it impacting your present life. So, and therapy is a long term. Therapy can be long term, and therapy is usually aimed at personal growth, self awareness, and deep healing. So, emotional healing. So, next, the scope of counseling, if we see, counseling often deals with present day concerns and helps, individuals develop coping strategies and problem solving skills. See, you can find counselors in educational institutions, career centers, community centers, school counselors, career counselors, marriage counselors, all of them. Next is the scope of psychotherapy. Psychotherapy is often more broad ranging, and can address a wide array of issues, like it addresses your emotional, psychological, and behavioral issues. So, this is not limited to depression, anxiety, trauma, various mental concerns. It may be the smallest concern as well. So, therapy can take place in various kind of settings. So, here private practices, mental health clinics, hospitals, and online platforms. So, like a virtual therapy. So, these words are used interchangingly, but they mean different. Counseling is different and therapy is different. So, in this book, both counseling and therapy are discussed, you know. And this book, why this book is important to read is, this book, as I said, demystifies therapy. That means you will get, the book provides behind the scenes to look at therapeutic process, what happens in a therapy session. It helps people understand that therapy is a collaborative and non threatening process, and normalizes seeking help. See, seeking help is normal, even for a therapist, even for a doctor. It they might need therapy. That means it is not that they're mentally ill or they have some issue. They just want to speak their mind, speak their stress out, able to talk about their stress and anxiety in, generally in life. So, through personal anecdotes and client stories, this book normalizes the idea of seeking therapy. So, this book shows that the therapy isn't just for those in crisis. That means this therapy is not for people who you think are mentally ill, but it can be beneficial for anyone looking to improve their mental and emotional well-being. So, this humanizes, therapists. The book, so this book, talks about, like, therapists are also humans. When we see, psychotherapists or doctors, it is not that doctors will not have any medical, issues, or they will not have any problems in life, or therapists will not have any problems in life, or they'll have answers for everything. This book, portrays therapists as empathetic, compassionate, and flawed individuals who have their own struggles. I have my struggles, you have your struggles. So, this humanization of the therapist can be reassuring for those who might feel intimidated or distant from the idea of therapy. So, what people think sometimes is, if you go to a therapist, the therapist will, read my mind. They will judge therapists on basis of that, and they will think that we should maintain a distance from a therapist. So, this says that no, therapists are also as human as other individuals. So, and this book reduces the stigma. See, it a person has to have so much of guts, to share her own experience as a therapy client, not only as a therapist. She as a client, she explains herself, how she underwent therapy for a crisis in her life as well. So here author helps reduce the stigma surrounding mental health treatment. That means this encourages readers to view therapy as a positive and constructive means of self improvement. And this book also offers some practical insights. How this book provides practical insights into the therapeutic process. So, including how therapists approach, different issues and challenges. How therapists also approach different issues and challenges. So this, what happens is, this can help decrease fears in the readers, and for a better understanding of what to expect when you are taking a therapy, or when you are going to a therapist for the first time. See, and then this also empowers individuals. Like, the stories in the book show individuals taking control of their lives and making positive changes through therapy. This can empower readers who may feel stuck or uncertain about their own paths. What happens is, sometimes we don't understand that what should we do in a particular situation or a crisis. Even then we can visit a therapist, because they can guide you, not by dictating what to do, just to find the path, how to go forward. So it this also emphasizes the human experience. So this book, gives various takes various case studies, so explores the universal themes of love, loss, relationships, and personal growth. So what happens is, this book is a reminder to the individuals or readers that they are not alone in their struggles, and seeking help is a part of the human experience. And this book also encourages self reflection in the sense, this book prompts reader to reflect on their own lives, relationships, and emotions, because it gives so many case studies, and how the author dealt as a two roles, as a therapy client and as a therapist. So, and also provides hope and inspiration for for growth, potential for growth, change, healing through therapy, all those things. So this book offers hope to those who may be hesitant or fearful about starting the therapeutic journey. So what next is this, this book, we can emotionally resonate with these books. So she gives all real life case studies, and it is very much relatable. The characters and the experiences are very much relatable, so we can emotionally resonate. And there are layered narratives. So this book weaves together multiple storylines, including the author's own experiences as a therapist, as someone also seeking therapy. This multi-dimensional approach offers a rich and engaging narrative. So, and this book, surprisingly, when I read, it is filled with humor and wit. That means you will have the moments where you will have a laugh when you read this book, and there will be moments where you will have a teary eye because of the emotions. So despite the the book deals with serious subjects, but the book is infused with full of humor and wit. So what happens is this lightens the tone at times and makes it enjoyable read, makes it as an enjoyable read, and even when addressing heavy topics. So next is, professional insights. As a practicing therapist, the author offers, I will explain all the insights that I could, my key takeaways and insights. She shares her experiences, and she sheds, light on the challenges that therapists face and the techniques they use to help their clients. See, therapists also have their own challenges in the practice as well. So, we will know that further. So, what are the challenges that psychotherapists face, you know, in their practice, everyday practice? So, and this book, helps in navigating grief and loss. So, one of the practical highlights is the way the book handles is grief and loss. How to handle grief and loss. So this book, as I said, gives, tools for self reflection. And I also said that this book gives a hope and builds helps, ultimately carries a message of hope and resilience. That means you can bounce back at any stage of your life. So it demonstrates that even in the darkest moments, there is a potential for growth, there is a potential for healing, and there is a potential for transformation. So, my key takeaways would be here. Therapy is about helping people understand themselves. So if you ask me what is therapy, it is clearly, defined in this book. Like, therapy is about, helping people. We help people understand themselves and take responsibility of their own lives. That means, you cannot come to a therapist and expect that therapist will tell you what decisions you are taking for your life. We only, you know take you how to take them, how to come out of your, see, the therapist's role is to guide patients, not to tell them what to do. We are not here to dictate to you what is to be done. We are only here to teach what path you can take. So, the reason a therapist can help a patient isn't because they are just better at life than the patient. Rather, a therapist helps by providing an objective perspective, bringing insights from their experiences and other patients. Of course, we therapists, read psychotherapy aspects, counseling aspects. Other than that, our experience and, expertise also will, as we become, experienced and gain expertise, we are able to help a patient better. So, and a therapist work is also to provide the patient or the client a safe non-judgmental space to work through their issues. So we act as unbiased non-judgmental, non-judgmental people or therapists, who are working, helping them working through their issues. So you don't have to think that if you come to a therapist, that therapist will judge you. It is not the judging is not the job of the therapist. The job of the therapist is to help resolve your issue, to delve deeper, to understand your emotional and behavioral patterns, your thought process, and then help you with that. So, therapy involves changing people's relationship with the past, to let go of the past. We can't alter the past, but we can stop fantasizing about a better past and do what we can with the present. How much ever I and you think about the past, we cannot alter our pasts. Instead of ये अच्छा हो सकता था, वो बेटर हो सकता था मेरे पास्ट में, अब मैं क्या बेटर कर सकती हूँ, दैट इज इम्पोर्टेंट. What I can do at the moment, at present, that is important. So this book also talks about the next thing is change is an inevitable part of life. So most of us resist change. हमें लाइफ में चेंज पसंद नहीं है. मतलब however our life is revolving, we want it to be the same. We usually fear change even when it is positive. Our current situation feels more familiar and safer. So it's never too late to change, but it's up to us to change our own lives. See, sometimes this book suggests that sometimes what we need to do is just get out of our own way, get out of that comfort zone and adapt the change. So we all suffer pain and loss. That means here pain is sometimes inevitable. See, the pain, the physical pain, your headache, your body ache, your abdominal pain, everybody, once or everybody, sometimes, in some aspect of their life experience pain. That is inevitable. But the emotional suffering, you can initially after you suffer, you can just let it go. It is in your hands that you keep suffering. Pain is different and emotional suffering is different. Emotional suffering is in our hands, whether we fantasize about the past and we still keep sulking over the past, keep sulking over a person, and keep suffering every day, or we let it go. So here this it's the book says that there is no hierarchy of pain. Problems that may appear trivial at their core often are driven by a deep fear or emotion. you know Actually, what happens sometimes is the problem for which people approach us is not at all the important problem. There is an underlying deeper fear or an emotion that is causing that problem. If we analyze that problem and we change that fear or emotion, then the problems become very small. So closure here in this book is said is a bit of myth. If you have had a deep loss, you may well feel the pain many years afterwards. So if you have lost someone in your life, even you might have come over the loss, but sometimes at a point you might feel the pain after years. You might remember that person, and you feel the pain and the suffering after many years. And some days will be more worse than the other days. It is not that every day you will feel that. So the aim of the therapy, the author clearly describes, is not to make the pain go away, but simply to integrate it into your life so that you can keep living your life. So, and the next important key takeaway I got from this book is therapists are human too. Sometimes people have the notion that if I say now, many of you might think, अगर थेरेपिस्ट ही थेरेपिस्ट के पास जाने की जरूरत पड़ रही है, थेरेपिस्ट को ही थेरेपिस्ट के पास जाने की जरूरत पड़ रही है, तो वो हमारे प्रॉब्लम कैसे सॉल्व करेंगे. So is he really capable of solving other people's problems if he himself or herself requires a therapist? So what happens is, here this book says that therapists are also humans. They may also have their own struggles, their own crises. It does not mean if they're talking to some other seasoned therapists that they are mentally not stable or mentally ill or they have some mental health concern. It is just that, as I said, they want to speak their mind out. They want to discuss some issues where they feel that they are not able to completely get a resolution out of it. So sometimes therapists don't know what to say in a therapy session. See, therapy is an art, and therapists constantly have to weigh up how best to help a patient. As I said, see, in therapy as well, initially, the when we start gaining experience, expertise, when we talk to many people and clients, we are able to gain more insights and help better. So it can be difficult to see a patient as they truly are. So patients generally want to be liked by their therapists, and so may hide their flaws and give you know skewed accounts of events. That means what happens is, sometimes clients do not reveal the entire, they may lie, they may hide some of the real issues, thinking that the therapist will judge me if I tell the truth. They often lies on so many things. So you have to be always honest and true to your therapist to for your problem to be resolved, to get a better solution. So, but patients often place unrealistic expectations as well. Once they come to the therapist, and they, even if they are hiding things or lying, you know, they expect that they have unrealistic expectation towards the therapist. So that is not gonna happen. This book also states that we have to be honest and as truthful as possible, giving all the details to your therapist to resolve your issue. You know and here all those and here the background of the book here is like, what is first it this book starts by Lori Gottlieb, a therapist herself, the author. She seeking therapy after experiencing a personal crisis. So she has a personal crisis now. She is a therapist, but now this book starts by her quoting that she seeks therapy for her personal crisis. So she talks about what is her personal crisis. So her boyfriend abruptly ended their relationship. She thought of marrying the boyfriend, but one fine day they were in a relationship. So one fine day her boyfriend abruptly ends their relationship, so leaving her devastated and grappling with feelings of rejection and heartbreak. She suddenly, when he did that, she was devastated, and she had the she felt that she was being rejected for no reason, and she had a heartbreak. So, as I said, her author's boyfriend breaks up with her unexpectedly, and the reason he gave for the breakup, that he doesn't really he gave the reason is, the author wa- is a single mother of a 10-year-old, maybe a child. So her boyfriend said that he was actually a good family, he actually bonded with her child and bonded with her family. But one fine day he said that he doesn't really want to have kids around anymore, and because he don't want to take the responsibility of the kid, as his as he also had kids, but his kids were going to graduate and they were going to leave house. But here the author's son is still very young, so he didn't want it to have her son around. So, and the author takes this, she took it quite badly, and she was depressed and devastated, as I said. So what she did was, it was not easy for her to think of a therapist. Now you may be thinking, she being a therapist, uh, she is trying to find a therapist. Yes, she tries to find a seasoned therapist, a male therapist. you know she wanted the therapist to tell her that she is right. Initially, when she thought of going to a therapist and have a conversation, she thought that the therapist will say that she is right and that her ex-boyfriend is a sociopath. But her therapist here it is named as Wendell, because she was visiting him every Wednesday. He is a seasoned psychotherapist, but here it is named as Dr. Wendell. But Dr. Wendell does not give her whatever, says whatever she wants to hear. So instead what he does is, he works with her, and over time he finds what is really bothering her. So this book is very interesting because she you know uh, portrays herself as as a patient. She lets us know that she is also vulnerable. That is, this book is interesting to see how the author observes her own behavior as a patient in light of her own experience as a therapist. So there is a difference between when she is a therapist and when she is a patient. So at one point, Dr. Wendell tells her that her feelings don't have to mess up with what she thinks they should be. So when she goes to therapist as a patient, she realizes that sometimes she said the same things to her patient many times what Dr. Wendell said to her. But initially she thought that she feels like she's hearing those words for the first time. So here Dr. Wendell, who she talks about, is a seasoned psychotherapist, a doctor, and his way is very unconventional way. So here she she's also a deliberately she is a deliberately unreliable narrator. The author says that we all are, when we become patients or clients, we are unreliable narrator. That means there are two perspectives of the story. Even in this case, there are two perspectives. One is the author's perspective and one is the boyfriend's perspective. A therapist cannot decide only relying on author's perspective. He should also take the her boyfriend's perspective. So it is said, so it's only well into the book that she reveals some important facts that she has been hiding. So what happens is, she also, as a when she went as a client or a patient, she also hid some things. from the therapist until he delved deeper and dig deeper. She also hits some things. She reveals everything in this book. So here the therapist role, what does the author's therapist role is very significant in this book. So the therapist plays a significant role in her healing process. In this book, he is portrayed as a wise, empathetic, and an experienced therapist who provides, Lori with the support and guidance she needs. So, here, this book, in this book, it talks about vulnerability and authenticity. From the very beginning, the therapist here, that means Lori's therapist, Wendell, models vulnerability and authenticity. There is a concept which the author talks about, that is called idiot compassion. That means if somebody comes to you, suppose, and is telling a story, and you're telling, yes, 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 you are completely right, that person is completely wrong, yes, that you are adding up to her perspective without knowing the perspective of the other. That is something called idiot compassion, that we sometimes you know um do, like we sometimes happen to have idiot compassion for our friends, for our relatives, for our colleagues, who say that, oh, without knowing the other perspective, the other side of the story, we tend to completely believe the story of theirs, and that compassion here is termed as idiot compassion. But the author says that a psychotherapist should have a wise compassion. That means it would be insignificant without analyzing both the perspective, both the sides, without knowing the full story, to give solution, or giving compassion. So you have to be authentic from the beginning here. The Wendell, who is a who is Laurie's psychotherapist, is authentic. He shares here personal anecdotes and emotions, showing Laurie that therapists are human too. He also kind of explains her that therapists are human too. So this section is the highlighting the power of authenticity in building trust and establishing a strong therapeutic alliance. So it emphasizes that therapists can be real and genuine while maintaining the professional boundaries. So the next thing about the psychotherapist, the author psychotherapist, is acceptance and change. So here, while they're conversating, while she's attending therapy, while the author, so Wendell helps Laurie confront some difficult truths and about herself and her patterns in relationships. He encourages her to accept herself as she is, while also gently challenging her to consider making changes. So both are important. Accept yourself as you are, and also consider to make changes. So if you have to change, so this underscores the idea that acceptance is often the precursor to meaningful change. If you have to undergo a meaningful change, first you have to accept yourself. So acknowledging and embracing our flaws, accepting our flaws, when we acknowledge and accept our flaws and limitations, then there is a potential for personal growth. It can lead to personal growth. How? You adapt some changes, consider making some changes. So Here one more thing is, Lori shares her feelings of grief and loss after the breakup. So here her psychotherapist provides a space for her to express her pain and validates her emotions. So it is very much important to express your pain, and the therapist also validates her emotions in the beginning. Then he kind of comes to that part where he tells that you are also wrong here. So what this tells is therapeutic value of allowing oneself to grieve and seek support during the times of loss. So you have to experience pain, you have to process pain. That means that you first experiencing and processing the pain and suffering is very much essential for healing, the for the healing process. Next part is self exploration and reflection. So here the author psychotherapist, Wendell, encourages the author to engage in self reflection and explore her own feelings and motivations. So one thing is, while she was blaming her boyfriend for what she did, she conveniently in the deeper hid that she knew that from prior that her boyfriend was not a good responsibility taker. So he was not interested in taking responsibilities. That's the reason why his um relationship prior to her broke up. So she knew that. So how did she come to know? When she started self exploring and self reflecting. So, and acknowledging patterns. So Wendell here helps Lori recognize certain patterns in her relationships and behaviors, and he also gently challenges how her to consider how these patterns may be impacting her life. So so this what this tells is power of self awareness in the therapy. So understanding our own patterns can lead to personal growth and the potential for healthy relationship. So, and also this talks about the therapeutic relationship, like the dynamics between Laurie and Wendell serves as a model for strong therapeutic relationship. They develop trust, mutual respect, and a genuine connection over the course of their sessions. This showcases the importance of the therapeutic alliance in the healing process. It emphasizes that a safe and supportive therapeutic relationship can be a catalyst for meaningful change. So the a safe and supportive therapy of a therapeutic relationship of a client and a therapist can be a catalyst for a meaningful change. So here overall, if we have to talk this you know Lori and her psychotherapist relationship is therapist seeing a therapist as a guide. So therapist as a guide means he does not tell you what to do, but he provides support and tools she needs to navigate her emotions and make positive changes. And this also talks about power of therapy. So when she experiences herself as a therapy client, so this reinforces the transformative potential of therapy. So her feelings changed, she got out of that breakup, she came out of that grief and loss. So this highlights that even therapists can benefit from, seeking potential help. But because she benefited, she took only few sessions, it was only few conversations, but it really helped her. Next is human connection. The relationship between Lori and, Wendell, highlights the profound impact of human connection in the therapeutic process. So, how empathy, understanding, and validation, all these are essential components of healing. So, also, like we said in the beginning, this, um, this is the personal growth story of personal growth and resilience. So, through her therapy journey, Lori experiences, personal growth and emerges from her crisis. She comes out of her crisis with newfound resilience and self awareness. So, her story here, why she is narrating her story, because to give a powerful example, of the leading, healing potential of the therapy. So, and, seeking help, and this book also reinforces the idea that seeking help is a sign of strength and courage. So we will talk about all the four case studies in detail in the next session. Let's not, treat going to a psychotherapist as a stigma or a taboo. Let's treat this as a normal thing. She's a, a best selling author and a psychotherapist. She still went to a therapist. So, if we have some problem, we should maybe talk to someone. Thank you for staying tuned, and namaste. If you have any insights and key takeaways you want to share, you can share in the comment section. You can also share any queries you have in the comment section. So thank you, and let me know how you felt of, the book Synopsis. It is still there. We have a part 2 on that, but till now what you felt, you can tell me in the, you can let me know in the comment section. Thank you. Namaste.